Now we will be chatting to Dr Jessica Stokes-Parish. Jess is a registered nurse and holds a PhD in medicine. She is really passionate about health education and diversity. Today she's here to talk to us about how we can determine truth from fiction in health education. Welcome to the show, Jess. Now you've had quite the interesting journey. Can you tell us a little bit about yourself, Jess?
Sure. Thank you so much for having me. So, a little bit about me. I'm a nurse, as you said. I have worked in oncology and intensive care, and it started me. Actually, I always knew I wanted to get into education. I loved education. So, I started working in the space of simulation, which is where we use mannequins and we recreate scenarios to help health professionals learn. And along the way, I've kind of stumbled through and done more postgraduate training and culminating in doing a PhD, which was completed this year, which is awesome.
Oh, that's so exciting. Now, I know that one of your passions is health education and really educating the broader community about that. Now, there's so much information out there. Can you just talk to us a bit about what makes a source reliable and how do we figure that out and navigate that?
You're not wrong, Nelu. It's so hard to navigate information. We have so many sources available to us. And so, some of the tips that I suggest to indicate whether something is reliable or not is whether it takes into account context or is it extreme. So, some examples of extreme might be telling you to follow a certain diet with your children or not using certain I guess, principles with your kids. And so it's really all about making sure that the information that you're given is appropriate for you in your situation, which we know is so different for everyone.
Right, so how do we check if information is reliable? So say a parent wants to find out about something, how do they know what they can believe and what they shouldn't believe?
So the first thing that I suggest to look at is who's the author? Who's writing this piece of information or who's speaking in the video? Do they have the appropriate qualifications? Are they a nurse? Are they a doctor? And if they are, do they have the right training, the right specialist training to be able to talk about that? As you know, anyone can talk about anything on the internet these days. We're inundated with messages, aren't we? Even if the message says, um, this is from a nurse, you need to find out who is that nurse, what's their name, where have they got their qualifications, can you check those qualifications? The other thing that I would say is check for a conflict of interest. So what I mean by that is the person trying to sell something to you. Are they trying to sell a product? Are they trying to sell a service? Is there some reason why they're telling you this information which would help them make profit?
Oh, they're really important tips to remember. And I think especially with parents, there's just so much information out there. What are sort of the main websites or sources that you would recommend for parents gathering information if they want to know about fever or something, for example?
It's a great question. And there are so many resources out there that are in multiple languages, that are in video form, written form. What I like to recommend is Raising Children. I think it's .net.au. And the other one is the Royal Children's Hospital in Melbourne. They're really accessible information, and you'll find your local hospital and health service also has information about fevers and anything general around your child's health.
That is all so useful. Now, for the benefit of our broad range of viewers who have various different cultural backgrounds, what's some of the issues that they might come across and what's some of the advice that you can give them?
It comes back to that example of the WhatsApp message, for example. I think that we trust our family, we trust our friends, and there are so many messages that are shared amongst. I remember my yaya, I'm Greek, and they, they're sending me messages saying, "Is this true? Did the nurse say this? Did the doctor say this?" No, actually, it's completely false. Somebody has fabricated it. So what I would say is, if you do get a message that's sent from a friend or a family member, just go and check the source. If there's no source or link and there's no public statement from that hospital or that source, then it's probably not accurate.
Great advice, Jess. And then in terms of people who want to get more information, say in their own language, do you know of any sources or how they can go about getting that information?
Well, the way that I found them was I just typed in into Google raising children and languages or translations, and it actually comes up with all the spaces where the articles are in other languages. And you'll find that on all the government immunisation websites as well. You can find them in other languages. They've got quite a range. It's not fully comprehensive, but it's a pretty good range.
Oh, fantastic. That's really good to know. I guess the other thing to mention as well is that in appointments and things, that there are interpreter services available generally. So I just advise parents and families to speak up if they're not understanding due to a language barrier. Do you see that a lot in your work?
Yeah, we do, and you're right. There are translators and interpreter services available in public hospitals. Sometimes there can be a bit of a delay, especially in the clinics. You know, you have to pre-organise it. So do make sure if you do need an interpreter, make sure that you organise it in advance so that they're able to be there.
Thanks so much, Jess, for the chat. Where can our viewers find you if they want some more information about these topics?
Oh, great question. I'm on most social media channels, so at J_Stokes-Parish. And I also have a website, jessicastokesparish.com.
Fantastic. Thank you so much, Jess, for joining us today.
Thanks for having me.